Oh man, that was a huge shot. Fishing for bullets, suspicious syringes, and impregnated with ointments? Today we are breaking down and reacting to the realistic medical scenes and healing animations from the first-person action game ESCAPE from Tarkov. Let's dive right in. Oh, I like the injection. What is he injecting to himself? Most likely either pain medication, probably like morphine. It's an auto injector, pushing the button and it injects in. Something similar that we have, epinephrine. If somebody has the EpiPen, it's an auto injector. Some people who are diabetes sometimes have almost like an auto injector like this for insulin, where they can put the dose on the outside, calculate it, and then they can inject it in. Oh man, that was a huge shot. Definitely got shot injured because I see on the upper left that there's a change of color to the left arm. So I wonder if he got shot and needs to be healed. What can you give yourself that could actually heal that fast? Nothing really. Your choices are basically pain medication, adrenaline, maybe a topical or an injectable anesthetic like lidocaine just to help with the discomfort. Could be ibuprofen, could be Tylenol. Walking around. Typically, if you're going to do an IM injection, you want to go into a big area, big muscle. That's why at the hospital, we typically use the shoulder or the deltoid, or we'll use your buttocks or the big glute.
Maybe just one glute?
It's also an area where there's a lesser chance that you're going to hit a vessel, because the whole idea is you're going to inject these intramuscularly, not intravenously, and you don't want to hit a blood vessel because then the doses are different. Oh, we got a med bag. Trauma shears, really cool. One of the blades basically has a little lip on it to help get underneath stuff. Oh, I don't know what he just took out there. It looks almost like a type of forceps, like a ring forceps or Kelly clamps, so you can actually grab something. They are ring forceps, actually. On the end, they're circular, so you can grab things easily. That's what that's for. You can also clamp things down.
The clamps!
Oh, we got a screen with some blood. Shot to the chest, possibly. Here we have a syringe, because you can see the plunger on the top. Trying maybe to show that we're doing it intravenously versus IM, but through the clothes. Typically, we tell people to do the auto injectors. If you're giving IM, clean off the surface. Whatever's on your skin is going to get inoculated into your tissue, which increases the risk of infection. Cool weapons. Oh, we got some bandages. Okay, so sometimes we call these like curlics. Typically, if you're gonna wrap a wound, put some more heavy gauze in the area, then wrap it so it stays in place, compress the area. Sometimes what you can do is actually split it in half at the end, and that way you can actually tie it into a knot around the area. That way, if you don't have tape, you can do it that way. Oh, we got a bottle of pills. Just carrying a bottle of pills in my pants.
A bottle of pills.
Purple label. Can't really make out what the lettering says, but really cool, very interesting. You're trying to open the bottle and you can't because you gotta like push it down, push pressure, and then turn it. One big pill like that. I know people out there probably have had prescriptions for 600 or 800 milligrams of ibuprofen. They look like that. Antibiotics look like that as well. Could be pretty much anything. If anybody knows, let me know in the comments. Speaking of pills in the pocket, I don't know if you guys know or not, I launched a supplement company called Life Happens. These are not just your everyday vitamins that you've seen on the shelves. These are as needed when life gets you, researched and studied ingredients. So definitely check it out. Oh, we got another med kit. I actually have a med kit that I travel with, even though it's just civilian travel. I want to make sure that I have like sutures and a needle driver just in case. I have some numbing medicine. I got a lot of bandages. Oh, what is this? We got some like salve. We got some balm.
Who told you to put the balm on?
Is that used for the lips? Is that used for the skin? Really good for hydration. Even if you're getting like windburn, it's good. You don't want to have like cracked bleeding lips. You don't want to have like cracked uncomfortable skin. So you definitely would use something like that. Or is it used to like clean your weapon or moisturize your gloves? You know, that's another thing that people do with this stuff. Oh, there we go. Is this like a Meal, there we go, an MRE, right? MRE stands for Meals Ready to Eat.
Mr. E.
I think you do have to do some heating maybe to it, put it out in the sun. Tell me if you've ever eaten one of these. Really cool that it's in the game. In the emergency department, people are always asking about food. I mean, it's not the best. We got graham crackers, we got turkey sandwiches. Turkey sandwiches are very specific. It's actually been studied. We specifically have them for people who might be hypoglycemic.
I'm hypoglycemic.
It actually helps with the blood sugar the best, as well as juice. Really cool, that white piece right there is a type of staple gun. Sometimes they're that big. Those are so much easier to use. Then we have really little ones. In the emergency department, we typically will use on the scalp and maybe some big, massive areas. But most of the time, if it's anywhere else, we'll actually suture it with just simple interrupted stitches. So cut off the clothes. Is that supposed to use the tool to pull out the bullet? That's hilarious. We don't go digging for bullets. We do not take them out. If it's just superficial where it's so easy to like grab it and like pop it out like a pimple, no problem. But other than that, if it's deep buried into the tissue, it's left there. Causes a lot more devastation to the tissue as you try to get it out. Oh, cool. I like this med kit. What's this? Oh, we got some bandages wrapping around the arm. Very cool. That almost looked like 1-inch tape going around. Could be wrapping something. Different types of bandages that actually are impregnated. Yes, I said that word, impregnated, with different ointments and antimicrobial things to prevent infections. Oh. We got a needle popping off. I love the technique of like flipping it off. At the hospital, we don't do that because somebody's got to pick it up and I'm not going to make somebody else pick up my trash. We deal with a lot of people, unfortunately, that use IV drugs illegally and they inject and they miss the vein and they inject into the subcutaneous tissue, into the muscle, and then cause bad abscesses and infections. Oh, this is a sweet bandage. That was actually a huge bandage that probably has some sort of special medicinal properties in it. If you're bleeding, cover it up. A lot of pressure. What we're not seeing in this video game is the fact that you're not putting pressure directly onto the wound. You're just wrapping it and covering up quick injections. I mean, it's fine. It's for the speed of the game. It would be cool to be shown, hey, you push pressure on it. Looking at the image, we got arm problems and abdomen problems. All right, wrap the arm. Oh, that looks like a type of tourniquet. Probably not tight enough. I carry a tourniquet in my car as well as in the house, just in case. The classic one, it's the cat, and it's basically a tourniquet that velcros onto itself, and then it actually has the ability to twist, so then you can actually make it super tight, and then it will lock in place. And then you actually want to write on it, there's a place for it, of when you actually put it on. We just like to know how long a tourniquet has been on there. ESCAPE from Tarkov, awesome. Really good graphics. I like all the medical components. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.